Something that I can see sometimes when reviewing labor and delivery records is missing fetal heart rate readings. And I'm not talking about just a few seconds here or there. I mean, in some cases, I've seen 30 or to 40 minutes worth of readings just gone. And there's nothing in the record that is explaining why this is the case. This could mean that during that time, no one knew what was happening with the baby. The nurses, the doctors, the entire team, they were essentially flying blind with this entire process. And if the baby was in distress, no one saw it. If there were signs that the labor was becoming dangerous for the baby, no one acted. And for babies who are later diagnosed with an HIE or a hypoxic ischemic encephalopathy or a subsequent CP diagnosis, this is something that families can sometimes look back on and they can wonder about all of this. Was there a moment when things could have been handled or things could have been done differently? Fetal monitoring is supposed to be a safety measure. It is there to help doctors and nurses be able to recognize when a baby is struggling before the situation becomes an emergency. When it is used continuously, it means that the medical team may have already identified a reason that they need to watch the baby more closely. Maybe there was a concern with the baby's heart rate earlier in labor. Maybe Pitocin was used, which can sometimes make contractions too strong or make the contractions come too frequently. Maybe there was a risk like meconium in the amniotic fluid or a previous delivery for mom that had complications. But if the monitoring is only effective if someone is actually making sure that it's picking up the baby's heart rate. When there are long gaps with no readings, it's impossible to know how the baby was handling labor. And I've seen in cases where, like I said, the monitoring strip, it goes blank for 30 minutes, 40 minutes, or even sometimes longer than that. And in the records, there is nothing explaining what happened or what was going on during that time. There's no note saying that the monitor was being repositioned, or there's no sign that anybody even noticed that the readings were actually missing. And when that happens, it means that no one was really watching the baby. And that is where things can get dangerous in this type of situation. The brain needs oxygen, and that's why fetal monitoring is so important. When the baby is not getting enough oxygen during labor, the heart rate can show certain types of warning signs. There could be prolonged decelerations where the heart rate drops and it stays low for too long. There may be things like minimal or absent variability, meaning the heart rate is not fluctuating like it should be. These can be signs that the baby may not be coping well with labor. But if there are 30 or 40 minutes of missing records, no one is going to be able to see these types of warning signs. No one is going to know if the baby was actually struggling during that time period. And if the oxygen levels were dropping, there's no action that's going to be taken. And that's how HIE can happen. This is how brain injuries leading to subsequent CP diagnosis, this is how they can happen. The scariest part about all of this is that there are moments that could make a difference between a healthy baby and a baby with a brain injury. A baby who needed intervention but did not get it because nobody on the medical team was paying attention to what was going on. And this type of situation, this is not the mother's fault. Some moms will look back and they will wonder, is there something that they should have done differently during this process? Maybe they moved too much, or maybe they should have asked more questions. But the truth is, it's not your job as a mother to make sure that the monitor is working. That is the job of the medical team. That is what they are there for. That's what they are supposed to do. Nurses are trained to recognize when the monitor is not picking up properly. They are trained to reposition it, to adjust it, or to escalate concerns if they cannot get good readings. If they are not getting a good, if they're not getting a good reading on your baby's heart rate, they should be asking, why is this happening? Why are we not getting a good reading? When these readings are missing, doctors do not have the full picture. If a baby is struggling, those are minutes lost. Minutes that could be the difference between intervention happening in time or too late. If your baby has been diagnosed with HIE or subsequent CP diagnosis, and you've looked at the records and you've seen gaps in the monitoring, that's worth something to really look into. Again, I'm Marcus Boston, and if you have any other questions about your baby's HIE, brain injury at birth, or subsequent CP diagnosis, if you have these types of questions from a medical legal standpoint, don't hesitate to reach out and contact me. You can find out more information about me if you check my profile. I have information there, which you can find me. If you're on certain apps and you're watching this on certain apps, you can send me a DM and we could chat a little bit about what you got going on with your baby story. Or you could just wait and get my information on the picture that follows this video. All right, that's going to be it for this Wednesday afternoon's quick educational video. Have a great day, everybody.